So we've been talking about all morning long, thousands of Southern California students are heading back to school this week. So if your child is someone who's feeling anxious about readjusting, our guest today might just be able to help.
Joining us with tips for soothing that anxiety, Director of Behavioral Health for Blue Shield of California, Dr. Nicole Stelter. Thank you so much, Doctor, for talking with us. Let's go right into this.
Good morning.
So many questions. Are you seeing some very specific trends in regard to mental health among our youth?
Yeah, so I think prior to the pandemic and COVID, all the shutdowns that went with that, we were already starting to see a rise in anxiety and depression symptoms amongst our youth. And the COVID and handling the pandemic, coming in and out of schools, mask rules, all of those things that made it that much more difficult. So I think we anticipate that to continue for a while.
As it is expected to continue, what advice do you have for parents out there who are seeing this anxiety in their kids?
Yeah, I think, I think one of the things you can do is simply ask and kind of make it a pretty normal thing. So it's not unexpected. It's not a sign that you're sick or crazy, that kind of thing, if you've got worry or feeling sad. And I think sometimes we are concerned about asking our kids, thinking that, maybe I'm going to infect them with depression or make them worry when they're not already worrying, if I ask. And so being able to do that and just kind of make it normal, normalize it, make it something that is just part of the conversations that you have on the regular.
So do you have any other very, very specific tips for parents? Because sometimes we almost need a roadmap, dealing with some of these.
I don't need to listen to you, Mom, right? Yeah, situations.
What would be the specific tips you would have?
Yeah, thanks. And thanks for channeling my own teenage boys, Mark, and that. So, I think, we want to make it okay for them to ask for help or to talk with any trusted adult, right? So parents are the first kind of line of defense, but there are also teachers, there are friends, there are staff, coaches, school staff. There are a number of places that they can go to get support. There's a lot of great support online. I think one of the biggest things I tell parents is when you're asking questions, it's kind of an open-ended question, right? So sometimes we want to come at our kids with, well, you're not afraid, are you? Or you're not worried. And that's really kind of, it puts a lot of judgment on what's going on and what my expectation is of my kid when I'm asking a question. So asking something like, what are you hopeful about this next school year? What do you, or is there anything you're worried about? Is there anything you're really looking forward to? Questions like that.
So how does sleep play a role in mental health, and what can be done to improve it? Assuming kids need a lot of sleep, don't they?
Yeah, for sure. I mean, if you think about, as a kid, your body is growing, your mind's growing. So sleep is that time when your body and your mind are really kind of assimilating the day and recovering from what happened and what you need to prepare for the next day, renewing, refreshing. That's what's going on in our minds when we're getting sleep. And so kids have a lot more of that to do, right? Because they're growing. And the easiest thing I would say is, and especially related to school, routines are really important. Sometimes we underestimate just the real simple things like, essentially don't let the first day of school be the first day that you plan what time to get up, how long it's going to take you to get ready and get out the door to make it to your first class, that kind of thing. But also those other kind of what we don't think of, and we sometimes underestimate the positive impact of exercise, making sure that you're, eating as good as you can, stay away from nicotine, and, power down from things like social media and screens at least an hour before you need to go to sleep.
What about some resources, some mental health resources for parents, educators, and maybe even students? If they don't want to talk about it with anyone
Sure.
that they know, is there somewhere they can go?
Sure. Yeah, there are a lot of places. So we have a site, Blue Sky is a program for Blue Shield of California that we really like. And some of what's great too about the Blue Sky site and other sites that you'll find, right, is that it's a portal to not only resources that we can offer for free online, but also a great portal to other sites that are reputable and can give really, good information. There is always your PTA and your district mental health or support sites. Oftentimes that's also a place you can go to not only get information for support, but also to find out, what are my school's plans or what's the district's plans in case of an emergency. Some of those questions our kids have about, what happens if there's some kind of emergency on campus, and the not knowing is more stressful. So going out to the district site to find out what that looks like, that can be really, really helpful. But I would say those are two of the biggest places I would encourage people to go check out.
And in terms of the pandemic, it's been challenging for pretty much everyone, of course, but you're optimistic about some things. What are you optimistic about?
I am. I think one of the wonderful things as a mental health professional that we've really seen is a decrease in the stigma, right? It's just gotten a lot easier to talk about some of this, talking about substance abuse, asking questions. We see celebrities and athletes that are coming forward about their own struggles. And it's just making it more of a kind of a normal conversation, as before it really wasn't. It was a much higher hurdle to clear, stigma was. And so the more that we talk about some of this, the more we ask questions and support each other, the lower that the threshold for getting to that conversation is going to be. And so that's one of the things I am the most excited about, is seeing stigma reduce.
We really appreciate all of your time this morning. Thank you for that. For more mental health resources for you, you can check out Blue Shield of California's Blue Sky program at the link right there on your screen. Thank you again, and we are going to take a quick break. We'll be right back.